Hi guys, I hope you're doing well and I welcome you to today's session where we are going to demystify cervical cancer. It has been ranked as the third most common cancer in the world and is a leading cause of death among women. And therefore, guys, we need to understand what it is and also know that there is something that we can do about it. The cervix is a part of the female reproductive system and is located just above the vagina and is the entrance to the uterus. So this cancer affects this part that we are calling the cervix. The most common cause of cervical cancer is a virus known as human papilloma virus, HPV in short. And HPV is a sexually transmitted virus, meaning that this virus is transferred from one person to the other through sex. It then affects the cervix, and a person having cervical cancer may not have symptoms at the initial stages of the cancer. We have various stages of cancer, that is starting from stage 0 all the way to stage 4. Stage 0 means that there are precancerous cells, like these cells are not yet cancerous. And then we move to stage 1, where the cancer cells are only located in the cervix. In stage 2, the cancer cells are both in the cervix and in the uterus. In stage 3, the cancer is located in the pelvis and has not gone outside the pelvic organs. In stage 4, the cancer has now started to go to outside the pelvis and into the other parts of the body. And this is what is now known as metastasis, when cancer moves from one region of the body and is able to go to other parts of the body, to include the lungs, the bladder, the heart, name it all, because the cancer cells are able to grow and move very fast. In the early stages of cervical cancer, a person may not experience any symptoms, and that is in stage 0 and in stage 1. From around stage 2, a person may experience symptoms such as bleeding between your periods, bleeding during sexual intercourse. You may have bleeding in postmenopausal women. Menopause begins at about the age of 45, or when a person has stopped receiving their periods, and therefore this person may experience bleeding after their menstruation already stops. That is what is known as postmenopausal bleeding. This person may also have a vaginal discharge that has a very strong odor, and the discharge may be tinged with blood. I know we have other infections that may present with these symptoms, but then that is where we have tests that come in to identify whether it's just a mere infection or it is cancer that has developed. We then need to understand what may predispose us to acquiring cervical cancer. And borrowing it from the major cause of cervical cancer, the most common risk factor to developing cervical cancer is Hpv virus. There are over 100 types of Hpv virus, and just about 13 of them cause cervical cancer. So having HPV in your body is a risk factor for you to develop cervical cancer. The other risk factor is having multiple sex partners. We have said earlier that HPV is transmitted through sex. So when you have multiple sex partners, you increase your chances of having HPV. The other risk is starting sexual intercourse at an early age. This simply means that HPV can be introduced to your body at an early age through sex, and over time it may develop to cancer. The other cause is other sexually transmitted diseases such as chlamydia, such as gonorrhea, name them all. They are also a risk factor for you to develop cervical cancer. Smoking is another cause of cervical cancer, and In a recent video I did, I talked about how smoking leads to various types of cancers, and cervical cancer is one of them. I would now like us to understand the various ways through which cervical cancer is treated. One of them is through surgery, and this involves the cutting out or the excision of the affected part. And this may only apply in the first stages of cancer, before this cancer has grown out of the cervix or the uterus into other body organs. The other mode of treatment is radiotherapy, and this is where radio is used in shrinking the tumor, and can also be used as a palliative way of managing cancer. The other mode of treatment is chemotherapy, and this involves the use of drugs to manage cancer. All the three methods may be combined for better outcome. And remember that the type of treatment that will be given will be dependent on the stage of the cancer. In later stages of the cancer, what is done mostly is what we call palliative care. And this involves trying to relieve the symptoms for you to just have a quality life. At the later stages of cancer, mostly there's nothing much that can be done for you, just some palliative care, as I have said, to help you live a quality life through the disease. Having understood the basics of cervical cancer, we are now going to discuss what we can do to prevent cervical cancer. As I said earlier, guys, there is something that we can do about it. We have a lot of power within us, and so I would want us to go through the various things that we can do to protect us from cervical cancer. First and foremost is the Hpv vaccine. Guys, if you didn't know about it, Hpv vaccine is very much available in our health facilities. In Kenya, Hpv vaccine is being administered to all girls at the age of 10 years. And it's given in 2 doses, the first dose, and then the second dose is given after 6 months. I know the schedule is different in various countries, so you can get to liaise with your health providers and get to know the schedule that they are using for Hpv vaccine. I know in some countries Hpv is being given to boys as well, and that is very okay because boys are the carriers of Hpv virus. I know most of us have been passed by this opportunity of being vaccinated, but being the parents to the future generation, I would encourage us to ensure that our children are vaccinated against HPV, and we will have done them well, guys. So I also understand that adults are also given HPV vaccine if they have not had any sexual activity. That is, if you're still a virgin woman, you can still get the HPV vaccine. It is very okay for us. No problem has been noted with the vaccine, so let us uptake the vaccine. Statistics in Kenya have shown that the uptake is very low. Lately, I have been at the vaccine depot and we have vaccines that are almost expiring. Yet we have the 10-year-old girls who have not been taken to be vaccinated. So if you know a friend who has a daughter, or you have your daughter at 10 years old, kindly get them vaccinated. The other thing that we can do is have regular cervical screening. This is a very important thing that each of us needs to do, as long as you are a woman who is already sexually active. There are procedures that are readily available to us, very easy procedures and very painless. Oftenly, I am involved in screening women for cervical cancer, and I have noted that most women are afraid of the procedures. We have various myths going around, and I would want to let you know that the procedures are painless, they do not take much time, and they are very safe for you. There are procedures that have been brought very close to us, but apparently we are not appreciating what is available for us. So guys, I would like to encourage each of us to take a step and get our cervixes screened. Among these procedures is a very easy procedure that is known as Vayavili. I am not going to get into the details of the procedure, but basically it is a very fast and painless procedure. We just have some chemical that we apply to your cervix, and we are able to check for any changes in the cells of your cervix, and we are able to advise accordingly. It is a procedure that is available even in your nearest dispensary. So I don't know what is keeping you guys from getting screened, and this should be done at least once every year. The other procedure is what we call Pap Smear. It is a more advanced test, and it's available in probably the higher health centers, and it's also a very fast procedure where a piece of tissue is removed from your cervix and it is investigated just to find out whether the cells are normal. We also have the HPV virus tests that can be done on you. So guys, let's get ourselves screened. Let's keep ourselves in check all the time. It's not being pessimistic. We are just concerned about ourselves. And as we have said earlier, cervical cancer can be managed completely if it's discovered at the very early stages. And remember, we said that at the early stages of cervical cancer, you do not have any symptoms. And this is where screening comes in. If you go for screening regularly, and God forbid that you have a problem, it is identified very early in its early stages, and it is managed completely. Unlike you just sitting around and waiting and watching for symptoms. You get those symptoms at stage 2 and above, and there's nothing much that can be done for you. It becomes more of a problem to manage the cancer at those stages. So people, let us embrace screening. Take up the opportunities that have been given to us. You really don't need to wait up for a campaign for you to get screened. Get yourself to a health facility, go request for screening, and that is one of the best gifts that you can give to yourself. Okay? The other thing that you can do is avoid multiple sex partners. We have discussed that sex is what transmits HPV virus from one person to another. And so you need to avoid having multiple sex partners. Avoid smoking. Smoking causes many types of cancers, and cervical cancer is one of them. So if you're a woman and you are smoking, kindly quit smoking. Also endeavor to have safe sex. That is by the use of condoms, and that will help in prevention of transmitting the HPV virus. So having discussed all that, even if you didn't get any other thing from this discussion, please remember we have the HPV vaccine and we have screening services that are available for each of us. That's all for today, guys. I hope that the session has been of benefit to you, and if so, kindly share it with all your girlfriends and let them know that we are not powerless, that there is something we can do about cervical cancer. You can also consider giving us a thumbs up and also subscribe to the channel so that we are able to reach out to more people and be able to benefit together. Thanks very much for watching, and until next time, goodbye.